Before you rush off and get a CPAP machine, watch this video. All right. Now, a good mate of mine, he's only 30 years old. He's a young fella. He's feeling tired, he's snoring, goes to see his doctor. His doctor says, here's a referral for a home sleep study. So he goes across to the Austin hospital, they wire him up, send him home, he sleeps like crap, and then 6 weeks later, he goes back to the sleep and respiratory physician to get his results. And the doc sits him down and says, yep, you've got sleep apnea and you can get a CPAP, that's the best, or you could get a mouth guard, or last of all, surgery. They're your options, take your pick. That's how it went. And old mate, he is so confused. He's like, Nick, what do I do? Which option do I take? I said, can you get me a copy of your sleep study report? Just want to have a glance over it first. So he calls up the Austin hospital and says, I need my report. And they said, unfortunately, no. We can only send your report to a healthcare professional. It's not for your eyes. So I drafted him up a letter because that's incorrect. He sent that letter to the Austin hospital and we got the report. Right, so there's the first lesson. You always have access to your sleep study report, including, if you want it, the raw data. Not just the report, the actual raw data from the test itself. All right? You can get access to everything if you want it. But I just needed access to this report. And we're going to go through the report, talk about the report, talk about the advice, the clinical advice or lack thereof that has profound consequences for a patient's well-being, their health, their life. For God's sake, we need to do better. So the first page is just a whole bunch of sleep and respiratory statistics and some notes from the sleep tech, okay? And then on the second page, we have some more notes from the sleep tech. However, we also have what is supposed to be the most important part of a home sleep study report, the conclusion. And the conclusion is written by the sleep and respiratory physician. This is the doctor giving their diagnosis, prescribing treatment options. Let's read this conclusion here. And they're paid good money for this. Obstructive sleep apnea, mainly when he was supine. 8 words. It reminds me of that movie with Leonardo DiCaprio, Catch Me If You Can. You know when he's pretending to be a doctor? Do you concur?
Gentlemen, what seems to be the problem?
Bicycle accident. Fractured tibia about 5 inches below patella.
Dr. Harris,
Yes?
do you concur
Concur with what, sir?
with what Dr. Ashland just said? Do you concur?
Well, it was a bicycle accident. The boy told us.
So you concur?
Concur?
I think we should take an x-ray, then stitch him out and put him in a walking cast.
Very good, Dr. Ashland, very good.
Yes, I concur. It looks like a broken leg. Yes, it looks like sleep apnea. It is sleep apnea. This is not what you're paid to do. You haven't even mentioned the severity of the sleep apnea. There are no treatment options here. What are you being paid for? For God's sake, lift your game. Now let's check out the last page. And for me, this is the most important page of a sleep study report. And the first thing I like to check out is just the blood oxygen levels, all right? It stands to reason that if your breathing is pretty good, then you're gonna have nice, stable blood oxygen levels, hopefully up around that sort of 96, 97 mark, unless you're a smoker or you have some other issues with your lungs. And we can see here that it's actually looking pretty good through the night, the blood oxygen levels. Right? There's a few little periods here. You can see where it drops off down to sort of 70. That's quite low. One here and another period here. All right, and these are corresponding with REM sleep. Okay, you can see up here with the sleep hypnogram, R for REM. All right, he's got one period of REM here, another period of REM here, and another period of REM here. But what caught my eye is this. All right, so we've got the oxygen drops during the first period of REM, The oxygen drops during the second period of REM, but check out the third period of REM here, all right? Look, blood oxygen levels almost flawless. Why? Sleeping position. And this, once again, comes back to that snapshot in time, that one night that you spend with that home sleep test. A sleep test really should run over multiple nights, because one night's just not enough information a lot of the time. He sleeps on his side here during REM, and there's a big improvement in his blood oxygen levels. And there's a few other periods where he's on his side here, left side, once again, perfect blood oxygen. And another time here, once again, very, very good, okay? Minimal sleep apnea when he's on his side. So does he really need a CPAP machine? Potentially, but that's not the point. That's not the point I'm getting to here. All right, like I said before, the job of the sleep and respiratory physician is to guide the patient, all right? The advice and the recommendations that you give to patients, they will follow you, will dramatically impact their lives, potentially for the rest of their life, all right? This kid's 30 years old. Yes, he's snoring. Yes, he's feeling tired. But if the solution is stay off your back, which it will be for so many patients, or just, sleep on an incline off your back. I mean, why not try that out for 2 weeks? Hey, send him home with a bloody Sleep HQ02 ring, track his blood oxygen for 2 weeks and go, hey, how you feeling? Yeah, doc, actually I'm feeling a lot better now. Oxygen levels are good. Happy days. So I guess the take-home message from today's video is trust but verify. Actually, scrap that. Don't trust but verify. Much better, right? Before you rush off and spend the rest of your life battling with a CPAP mask connected to a machine, you're 30 years old especially, take a look at your data, right? Have a look at your sleeping position. Have a look at your blood oxygen. And if you want to track your blood oxygen at home, Sleep HQ02 ring. You basically got a sleep test every night. In fact, over in the US, Sleep Image, that's what they use. Enzo data, that's what they use. This is the home sleep test over in the US. Right, so you put it on your finger, you go to bed, you stay off your back. What was my blood oxygen like? Okay, simple.